The following is a presentation of the OR counts process, which is part of the Banner Safe Surgery process. Counts are performed to account for items and to prevent injury to a patient as a result of a retained sponge, sharp, or instrument. Robust and rigorous counting each time you count can prevent unintentionally retained foreign objects. All counts must be conducted by a scrub and circulating nurse.
Are you ready to count?
Yes, I am.
At the beginning of each case, before the patient arrives in the OR, a complete count must be conducted in order to establish the baseline count. Items added to the field during the case must be counted and added to the baseline count. The circulating nurse will record the baseline count on a pre-formatted, permanently inscribed whiteboard. All counted items on the field must be included in the baseline count. It is important to ensure that the baseline count is accurate because the baseline count is the standard against which all subsequent counts are compared. Then, as counted items are added to the field, the circulating nurse must document the added items so that an accurate count record is maintained. Both the scrub and circulating nurse must stand near each other while they directly view each counted item as they count out loud together.
3, 4, 5, 6. Straight, Kellys? 1, 2.
When counting sponges, both people must directly view the radio opaque marker. The count of each category, e.g. laps, needles, of items, must not be interrupted. If the count is interrupted, then the category of items in which the interruption occurred must be recounted. All sponges used during OR procedures must be X-ray detectable, except for ophthalmologic procedures. When counting lap sponges, the scrub should break the banding tape and separate each sponge by drop count. Lay each separated sponge on top of another, one by one. When counting Raytech sponges, the surge tech should break the banding tape and separate each sponge by drop count. Lay each separated sponge on top of another, one by one.
4, 5, 6, 7, 8, 9, 10. Blades. 1, 2.
Needles are counted and the tally is compared with the number listed on the package. Both persons performing the count will verify the number as each package is opened. Instruments are counted.
3, 4.
Curve, Kellys?
1, 2, 3, 4, 5, 6.
Countable items added to the field during the case must be counted and documented at the time they are added. The sponges are separated as in the baseline count.
1, 2, 3, 4, 5.
Count. When closing a cavity within a cavity. When closing a cavity within a cavity, such as uterus, bladder, or stomach, a count must be conducted. The provider will communicate to the circulating nurse when he or she places a sponge in the wound.
Lap in, Katie.
The number of sponges placed in the wound will be documented on the whiteboard. The provider will also tell the circulating RN when he or she removes the placed sponge or sponges.
Lap out.
Thank you.
A handoff of count status will be performed with temporary relief of staff. At the time of permanent relief of the circulator, a separate count must be conducted. Interim counts are performed when closing a cavity within a cavity with any permanent relief of staff. Closing count. A closing count is performed just before wound closure begins. Final count. At the start of closing the final layer, a count must be conducted. When multiple procedures involving multiple sites are performed, a separate count must be conducted and documented for each site. All counted items must be kept in the OR until all procedures are completed. Whenever requested by a member of the surgical team, a count must be conducted. A visual scan of sharps and instruments must be conducted before and after use to ensure product integrity. Broken instruments, sharps, must be accounted for and removed from surgical field. If a sharp or instrument is broken, all parts of the item must be documented on the instrument list that comes with each instrument tray and removed from surgical field. If a broken part cannot be accounted for, the procedure for incorrect parts should be followed. Accurate counting and documentation is critical. You need to know what went in to know what must come out.